welcome. Come on in, find a seat. We'll get started at the top of the hour, which I think is right now. Just got a few people coming in right now, so I'm going to delay for just another 30 seconds. Welcome, welcome. Okay, that looks like it's starting to settle down here. People still trickling in as usual, but let's get started. Hello, everybody. Welcome. My name is Alan Barr. I'm with COEH Northern California. And on behalf of all of the NIOSH-supported education and research centers throughout the country, we're pleased to bring you another installment of the 2025 ERC Ergonomics webinar series, where we offer free monthly webinars on various topics on human factors and ergonomics. This collaborative effort on behalf of each ERC's continuing education program aspires to provide access to current research supported through NIOSH ERC programs. Thank you again for joining us today. If you logged in with your registration email, you'll receive a link to an evaluation form, and that'll qualify you for a certificate of completion worth 1 CE contact hour. A couple of events upcoming on the 5th of November. We have The Future of Work is Now, revealing time trends in the California labor market. And then on the 4th of December, we have Collaborative Care in Motion, the power of nursing and ergonomics in workplace health. Please consider joining us for those. If you'd like to ask a question during today's webinar, please enter it into the Q&A. We'll save some time at the end of the presentation to address your questions. You are being recorded today. The recording will be made available along with all of our past webinars at the COEH Northern California YouTube channel. That's worth a look. In support of our work, please take a moment to like and subscribe to the channel. PDF of the presentation can be requested directly from coehce at berkeley.edu if you would like. That's coehce at berkeley.edu. Today's webinar title is Swine Processing and Worker Health Results from the PULSE Study, and our guest speaker for today is Dr. Carisa Harris Adamson. She is a PhD and a certified professional ergonomist. Dr. Harris is a professor in the Department of Medicine at the University of California, San Francisco, and in the School of Public Health at the University of California at Berkeley. She's also the director of the UCSF-UCB Ergonomics Research and Graduate Training Program and the director of the Northern California Center for Occupational and Environmental Health, COEH. She's also my boss. And with that, it's my pleasure to hand the mic over to Dr. Harris.
Thanks so much, Alan, and thanks to the CE team for putting this together and for all of you for joining us today. I want to first take a moment to call out my co-authors and thank them for all their work on this project. Dr. Bob Harrison is the co-PI of this project. Melissa Afterman, Alan Barr, Shefali Gandhi, Fred Gare, Frederick Houghton, Jenny Hilroyd, Aman Mehrotra, and David Rempel all contributed to this project along with almost 100 other students, which I'll get to at the very end. So I want to thank them for all of their efforts. And today I'm going to talk about the impact of line speed on worker health among swine processing workers. If you haven't seen the one on poultry, that was a prior presentation. You'll see some similarities in the methodologies, but certainly some differences in the study design and the findings. So today I'm going to talk about swine processing and why evisceration line speed has been debated over the years. I'll talk a little bit about the prevalence of exposure to high levels of ergonomic hazard. I'll review sort of the prevalence of moderate to severe upper extremity pain among these workers. And then we're going to talk about evisceration line speed and piece rate and their impact on ergonomic hazard. And then I'm going to finish with some slides that one of my PhD students just put together for the HFES conference, Aspire, on how we can think about ergonomic assessments to identify acceptable workloads and how technology can be used to apply hazard assessment methods similar to what we used in this study here. So a short background, repetitive exertions, forceful exertions, and non-neutral postures are risk factors for musculoskeletal pain and musculoskeletal disorders. MSD risk factors and high rates of injuries in swine processing plants has been reported for decades. NIOSH has been heavily involved in producing reports on this in this sector. A recent NIOSH health hazard evaluation documented a high prevalence of carpal tunnel syndrome symptoms and symptoms to different levels of ergonomic hazards. And they actually also use the ACGIH TLV for hand activity to evaluate hazard. Over the years, different risk assessment tools, including the ACGIH TLV for hand activity and the revised strain index, have been used to quantify hazard in this sector. And so here we are, decades later, still looking at the same problem, but it's a little different in that we were specifically looking at the impact of evisceration line speed. And this is because there were essentially in October of 2019, the USDA Food Safety and Inspection Service published a modernization of swine slaughter inspection that established a new swine slaughter inspection system that provided waivers for establishments to operate at more than 1,106 hogs per hour. In the past, that had been a negotiated number. So the evisceration line speed was capped at 1106. This modernization of swine slaughter inspection allowed these waivers that were provided under that pretense allowed these lines to operate faster. This was legally challenged in court. And so a judge stepped in and said that these NSIS establishments had to operate at a line speed not greater than 1106. And in response to that, the USDA said, okay, well, we're going to put together a time-limited trial that allows 6 establishments to operate at line speeds greater than 1106. Eventually, the USDA hired us to evaluate whether or not these higher line speeds presented an increased ergonomic hazard to workers at these swine establishments. So the primary aim of the study is to quantify the association between evisceration line speed and something called piece rate, which I'll go over in a minute, and measures of ergonomic hazard in U.S. swine processing plants that were part of this time-limited trial that had line speed waivers and were able to operate at evisceration line speeds above 1106. We asked them to operate at 2 different speeds. One week they were operating at 1106, and another week they were operating at their TLT speed of greater than 1106. If you're not familiar with the swine processing, the general process to process a pig, they come in at the front end. They're alive. They get stunned or gassed and eventually eviscerated. The speed that we're talking about is right here. It's after the hogs come in. It's this evisceration line point where the hogs are essentially killed. And there's a certain pace to that, and that's what is regulated. After this point of evisceration, the hogs go to a main chain. They then go to a section called offal, or some parts go to offal. There's a cooling process. They go to the cut floor and eventually get packaged. Now, the interesting thing about swine processing is that there are a lot of different jobs. So in each of these areas, the front end, the main chain, offal, and cut floor, there are a lot of different jobs. We looked at a total of 78 jobs in 4 areas. And so this was a little bit challenging in that we didn't have a lot of people performing the very same job at any given plant. However, we got over this challenge by making sure that we measured each person twice. Once when the establishment was operating at their non-TLT line speed at 1106, and once when they were operating at their TLT line speed of something greater than 1106. Now, I can't show you the exact TLT line speeds of the 6 establishments who participated in this study, but I can say that we categorize them into those that had a TLT line speed, meaning a faster line speed of less than 1,300 head per hour, and those operating at more than 1,300 head per hour. And this is just the average of the 3 establishments in this group and the 3 establishments in this group. Now, as you can see, there were 6 establishments total who participated in this study. And fortunately, all 6 of them were willing to operate at these 2 different speeds. We were able to spend time at their facility for 3 or 4 days when they were operating at one of these speeds. There was a weekend break, and then we went back the following week and we took measurements on the very same workers while the establishment worked at the other speed. The order of non-TLT and TLT line speed was randomized across the 6 establishments. And we talked about evisceration line speed, but I do want to talk about the components that are maybe more meaningful from a specific worker standpoint, which is the line speed that's happening in front of them, what we're calling the job-specific line speed, the number of staffing that are doing that particular job, so that would be the job staffing, and then the worker piece rate, meaning how many pieces of hogs is a worker handling per unit of time. And so, whereas job line speed might be the number of shackles on one line that passes by a fixed point per minute, job staffing might be the number of staff that are doing a particular job, like rolling the hogs over. Worker piece rate would be the number of hogs actually hung on the shackles by one worker per minute, or the number of hogs passing by one worker per minute, or the number of hogs cut or hung by one worker per minute. And so this idea of worker piece rate was really important because if we go back to this slide and we look at the swine process, evisceration happens here, but all of these other jobs happen before this evisceration line point or after this evisceration line point. And the actual speed of, say, the line in front of someone at main chain can be different than, say, that evisceration line. And same thing for offal or cut floor. So although regulation is based on this evisceration point, and clearly there would be some sort of relationship between evisceration line speed and perhaps jobs line speed or piece rate. When we talk about the actual work a person is doing, the number of pieces of a hog or hogs that they're handling per unit of time is really a better reflection of that individual person's workload. And that, of course, is dictated by both the job line speed and staffing for that position. And this is a little different because we're used to seeing an exposure like a measure like the ACGH-TLV for hand activity be our independent variable. But in this instance, it is our dependent variable. Remember, the independent variable is the actual line speed, evisceration line speed, or piece rate. And our dependent variable in this instance is our hazard measure, which is the PFI-TLV score. So if you're not familiar with the ACGH-TLV for hand activity, it's a hazard assessment tool that incorporates normalized peak force and hand activity level. You can see that there's a 0 to 10 scale on the hand activity level here and a 0 to 10 scale for normalized peak force. I'm going to go over different approaches later on as to how you can quantify these 2 measures and how we quantified it in this study. But essentially, we're looking at this solid line, which indicates a PFI-TLV score of 1. So if someone is working at, say, a hand activity level of a 4, you can see that their normalized peak force needs to be roughly a 4 or less for them to have a PFI-TLV score of 1. Now, this score of 1 is essentially where there's a 2-fold increase in the risk of upper extremity musculoskeletal disorders. And a lot of this was based on prospective epidemiological studies. You might remember there was a 2001 version of this TLV for hand activity based on prospective studies, both in the US and Italy. We identified that the 2001 version wasn't quite conservative enough. And so we did some modeling and found that with these different PFI TLV scores using both the Italian and US cohort, a PFI TLV score of 1 is equal to a doubling or a hazard ratio of 2.0, and that is identified as the maximal acceptable risk. Any TLV score greater than 1 would yield unacceptable risk, and then a PFI TLV score less than 1 would be thought of as acceptable. And we did have a survey that collected information on demographics, work history and organization, pain and discomfort that was qualified by being lasting more than 1 day during the prior 12 months. We asked about reporting, whether or not they reported their pain and prior injuries. We asked about their perceptions of the line speed and the break-in period, meaning how long did it take them to get used to their job without pain. We collected objective measures of normalized peak force using surface EMG. The surface EMG was collected using a cuff. This is an 8-channel forearm cuff. And from this, we were able to get people's maximum strength and the muscle activity during exerting a maximal voluntary contraction. And then we were able to calculate an APDF 90 from this data. And I'll talk to you a little bit more about how this worked. This cuff is really easy to use. It's relatively cheap. We get some nice muscle activity data across these 8 channels. You can see that when someone is doing a task like this simulated cutting task in our lab, you can see that the different channels are collecting muscle activity around the forearm. So it's more of a global measure of muscle activity versus measuring the activity of specific muscles. This is what the output will look like. And we essentially can take the 8 channels, normalize them to the activity during a maximum voluntary contraction. We can calculate an amplitude probability distribution function, which is a APDF for each channel. And then once we did that, we averaged the channels into a single APDF 90 value. And that was how we essentially summarized the muscle activity across the 8 channels. We did use a 5th order Butterworth, 20 Hertz high pass, 300 RMS, and 1000 MBC moving window as our parameters for processing the EMG. And once we got this APDF value, meaning we're taking the 90th percentile value here, we identify what the percent MBC is for that APDF 90, divide it by 10 to put it on a 0 to 10 scale, and that gives us our normalized peak force value. Now, I do want to point out that these parameters for processing the EMG data are important, and we try to use some very sort of standard parameters that we typically use in laboratory studies. For the hand activity level, we also had a very objective measurement or approach to measurement for both frequency and duty cycle. I can't show you a video, but the video was collected over a 10-minute period. We analyzed 5 minutes using a frame-by-frame approach. Each frame was categorized into different types of hand exertions. And from that, we were able to calculate both the number of exertions or the frequency of exertions, as well as the duty cycle, meaning the percent time that someone was in a hand exertion. We also used MBTA, this is multi-video task analysis, to quantify the job-specific line speed. So again, maybe how many shackles were passing in front of a worker at a given time. We also used it to quantify staffing. And we used it to quantify piece rate, meaning that measurement of how many hog pieces a worker was handling per unit of time. Now, I mentioned the normalized peak force being our APDF 90 value divided by 10, and that was from the surface EMG. The hand activity level, we use this calculation, which utilizes the frequency and exertions per second and the duty cycle to calculate a hand activity level score. And then using both of these, we were able to quantify the PFI TLV score using this equation here. Now, one thing I want to note is that the frequency of exertions is the number of exertions divided by the observed time, and the duty cycle was also the hand exertion time divided by that observed time times 100. As I mentioned, we collected data over 2 separate weeks, about 3 days of on-site data collection per week. That meant that we strive to have 2 measurements per person. That didn't always work out because sometimes people didn't show up for their second week. We had essentially study teams of 9 people on site each week. And you can see that we had about 574 measurements or measures of survey data. We had 36 medical interviews. I'm not going to talk about that today, but we did have some physicians conducting some medical interviews. And then we had 498 people measured at the non-TLT line speed and 519 people measured at the TLT line speed. And this is just separated by the 3 companies that were operating at a TLT line speed of less than 1,300 hogs per hour and a TLT line speed of greater than 1,300 hogs per hour. So in total, we had 472 people with pair data, meaning they had data both weeks. And then we had a range between 498 and 519 individuals who had data for one of these weeks, and then more people who actually had survey data. And this is going to make a difference in the analysis that we did, because some models used the pair data and some models used all of the data that we had. Now, in summary, we had the average age was 39.6 years, standard deviation of 11.3. A quarter were female, roughly, and roughly 70% were Hispanic. 91.8% spoke English as their second language, and 80.7% were born outside of the US. And their job tenure, about 22% had been working there for less than a year, and 43.4% had been working there for more than a year but less than 5 years, roughly 15% between 5 and 10 years, and 18% for more than 10 years. So we had a variety of job tenure in this cohort. Now, as far as symptoms went, 42% of workers reported experiencing moderate to severe work-related pain over the prior 12-month period. And remember, this was pain that lasted at least 1 day. Among those reporting pain, 19% had difficulty maintaining their expected work pace. 23% considered quitting or changing lines because of their pain. 35% reported having difficulty performing activities outside of work because of their work-related pain. 16% took paid or unpaid time off of work because of their pain, and 32% did not report their pain to their supervisor or nurse. So these numbers are really important because if you look at some of the OSHA logs, you'll see that the number of injuries, recordable injuries, has actually gone down over the prior years. And it's really important to note that that reduction in reported injuries is dependent on a lot of things. And so first, it's dependent on whether or not people feel comfortable reporting their pain. And you can see here that 32% of people in this cohort did not report their pain at all. It also depends on whether or not they actually were sent to a physician and provided medical care and a diagnosis and or treatment. We saw that a lot of people never reached that stage. So they were given first aid often for very long periods of time. And when they're given first aid and they're never sent to a doctor, that is not essentially recorded. So it's just a caution to know what data you're looking at when you're looking at those OSHA logs and those numbers. And in this particular cohort where there's a lot of underreporting, those can be certainly an underestimate of the actual experience of the workers. Okay, so this is a distribution of hazard scores for the workers. Nearly half of the workers, 46%, had a PFI TLV score greater than 1, and therefore were at increased risk of musculoskeletal disorders. This is a large number, not quite as large as poultry, but certainly, nearly half of these workers had this increased hazard. Now, when we looked at the establishments during their non-TLT week and the establishments during their TLT week, here's the PFI TLV of 1 line, and each dot is essentially a person. So you can see that roughly half during both the non-TLT and the TLT weeks, meaning when they were operating slower and when they were operating faster, were above that hazard threshold level of 1. The purple dots indicate those who have TLT line speeds of less than 1300, meaning their faster line speed was something between 1106 and 1300. And the green dots are those establishments that were operating at TLT line speeds above 1300. And so you can see there's not really an obvious difference between these two. There's essentially an equal number of green and purple dots on both sides of this line, more or less. Now, we use different models to evaluate differences in these different line speed categories. So first, you can see that we looked at the overall difference in median PFI TLV per 100 hogs per hour increase in evisceration line speed. And what this is saying is that there was a change of 0.02. And so as the PFI TLV as the evisceration line speed went up per 100 hogs per hour, there was actually a decrease in the median PFI TLV. Now, we then stratified this into the three, comparing the three establishments that had faster line speeds between 1106 and 1300, and those that operate at more than 1300. And still, we do not see very much difference in the median PFI TLV per increase in 100 hogs per hour. We then use conditional logistic regression to look at the conditional odds of having a PFI TLV score more than 1 per 100 hogs per hour increase in evisceration line speed. Now, this was using matched data. So this included the 472 people that had data at both line speeds. And what we can see here is that there is an increase actually in the establishments that were operating between 1106 and 1300 at the faster line speed. They actually had a slight increase in the odds of having a PFI TLV score more than 1, but it was not statistically significant. And there really wasn't much in this establishments that operated more than 1300. So at this point, we're thinking that there wasn't a lot of change, and we wanted to understand that a little bit better. And so we started to look at the individual level. How many people changed their hazard status, essentially, when the plants operated from at a faster line speed, evisceration line speed, compared to a slower one. And so here you can see all 471 match pairs, and there were 192, 40.7%, that were low hazard, meaning they had a TLV score of less than 1, and it stayed less than 1 even when the establishment was operating at a faster line speed. You can see that here there was 31.6%, 149 individuals who had high hazard at the slower line speed, and their hazard remained at the higher line speed, evisceration line speed. And then what's interesting is this group here. So for this column, these are workers who originally had PFI TLV scores greater than 1, so their jobs were considered hazardous. But it actually reduced to less than 1 when the evisceration line speed increased. And that could have been due to changing the staffing levels, for example, adding another staff at that job. This group of workers had low hazard, and when the evisceration line speed increased, their hazard increased above that threshold limit value of 1. And there's roughly an equal number of people overall that change from, going low to high hazard or high to low hazard. We then wanted to see whether these changes from one category to the next varied by the faster line speed group. And so here you can see in this the establishments that had a TLT line speed between 1106 and 1300. They had 12 and 16. Here was 13 and 12. Still not a lot of differences between these categories. And it's looking like evisceration line speed was not as important of a predictor here. However, what gets interesting is when we look at categories of PFI TLV score changing from non-TLT week to TLT week by establishment. And this is where we saw a lot of differences. So here are the 6 establishments, and I'm going to focus on establishment B and C. In establishment B, you can see that roughly a third were low risk, both line speeds, and roughly a third were high risk during both line speeds. But we also see that 26.9% went from low risk to high risk when their evisceration line speed was increased. And for establishment C, we can see that roughly 23.5% went from high risk to low risk when they increased their evisceration line speed. And so this showed us that there actually were these really big differences across establishments. In the other 4 establishments, there were some sort of different changes, but nothing quite as significant as establishment B and C, where we really see the stark difference in how they made the changes when their line speed increased and how that impacted workers' individual hazard. Okay, so also wanted to look, we also looked at the ratio of the median PFI TLV score per 100 hogs per hour using this was using a mixed effects parametric quantile regression model. And again, what we see is with establishment B and establishment C, this median ratio increased to 1.15 for establishment B. And yet you see that the median ratio, meaning the PFI TLV scores on average decreased for establishment C. And this was essentially per 100 hogs per hour. And if you were to sort of extrapolate that to say 300 hogs per hour, so that would be like running at 1,400 hogs per hour for the TLT, we'd see that the median score would go up quite substantially. This is a ratio of 1.34, which would mean that there's an increase in that PFI TLV score overall for establishment B, whereas establishment C, there was actually a reduction. Okay, we only looked at palletizing at one establishment, but I think it's worth looking at. And so I'm going to present a case study about this establishment because palletizing is a pretty common task across many different industries. There were a lot of establishments that actually had a vacuum lift, and the vacuum lift meant that we really weren't concerned about the lifting of the different pallets of meat products. However, when there was manual lifting of these cases of meat products onto pallets, we did want to evaluate that. We used the revised NIOSH lift equation, and we were using a score of 1.5 as our threshold for evaluating risk due to lifting. And so what we see in this one establishment, there were 10 people that were evaluated overall. And based on 5 individuals or 5 measurements at the non-TLT and 5 at the TLT line speed, we can see that the CLI, meaning the lift index, was really quite high. The lift frequency was 4.3 and 4.0 at these different speeds, and the CLI was 4.3 and 5.1. Again, the threshold limit value here that we're comparing it to is 1.5, and so this would be considered quite hazardous. So in conclusion, we found that the higher TLT line speed was really associated with mixed effects on musculoskeletal disorder risk. At one establishment, there was a statistically significant increase in MSD risk. In other establishments, there were no statistically significant changes in MSD risk, but there were differences. And at another establishment, there was a statistically significant decrease in MSD risk. And so this really told us that how people or how an establishment increases their evisceration line speed really matters. It appears that it's possible with good staffing and controls to actually reduce hazard levels when the evisceration line speed is increased. But if nothing is changed, meaning there's no change in staffing, then increasing the evisceration line speed can actually increase MSD risk. Regardless of evisceration line speed, 46% of workers across all the establishments had a PFI-TLV score greater than 1 and are considered at increased risk of MSDs. And 42% of workers at all establishments reported experiencing that moderate to severe upper extremity pain. And remember, with a large percentage of them not reporting that pain to their supervisors. There is a very in-depth study with many more analyses and a lot more detail on the USDA website. The link is here. You can also Google it just by Googling swine processing line speed evaluation study and the USDA. Of course, there were a lot of different interpretations of these findings. There were articles about alleviating line speed regulations for both poultry and pork processing because essentially it really, for poultry anyway, the piece rate was what the metric that mattered. For pork processing, line speed also mattered, yet because I suppose it, was different across the different establishments, we're not really sure what that's going to mean in terms of rulemaking for future line speed regulations for the swine industry. There were a lot of articles that came out from industry that basically said line speed doesn't matter and we should be able to go as fast as we want. And I think that's grossly misinterpreting the results of the study. And there were a lot of articles that came out that really talked about, the experiences of the poultry and swine processing workers and how these fast-paced conditions are being felt by them. And, we can certainly say that even at slower line speeds, whether it's poultry or swine, there's a lot of hazard, and the hazard really should be mitigated even at the slower line speeds. And certainly, I don't think the faster line speeds, should be allowed unless, that is paired with proper mitigation of the hazards that were measured at both line speeds. So our overall recommendations were to reduce the PFI-TLV score to less than 1 for all swine processing jobs. And this could be done using targeted job-specific piece rates, meaning when the line speeds are established, both for evisceration as well as the job, that it's currently the practice is not to incorporate what the hazard score is. That could be changed. We could look at things like knife sharpening best practices. We could look at staffing levels. We could look at what changes could be made to keep this PFI-TLV score to less than 1. And I think unless that's done, we're going to continue to have, what we've seen over the last decades of just, high injuries and pain experiences across these workers. For palletizing, the take-home message is, for 5 establishments, we actually didn't even measure risk due to palletizing these cases of meat. Because there are tools that exist that would prevent anyone from having exposure to these hazards that would increase risk of low back pain. In the establishment where we did look at this, the CLIs were extremely high, and simply, incorporating some better controls and devices into the workplace, like vacuum lifts and like pallet lifts, this could easily be mitigated. I also just want to talk a little bit about early reporting of MSD symptoms and providing appropriate care beyond first aid. Anecdotally, we did see some establishments with very organized plans where, there was first aid provided, and after a certain number of days or, symptoms, medical care was automatically triggered. There were also triggers in, visiting the person's work site and doing an ergonomic assessment. And then at other establishments, there really wasn't. It was left up to someone on site. There was a lot of variation in how first aid was administered and whether or not medical care was provided. Again, we saw or heard from people that they had been receiving first aid for, you know, weeks, if not months, and were never sent to a doctor. And that can be really problematic because that just tells people that there's no sense in even reporting their pain because they're not going to be able to get that medical care. So again, we saw some really great programs, and we saw some programs that perhaps were using people to administer first aid long after they really should be. So making sure that any kind of first aid providers, whether it be nurses or athletic trainers or whatnot on site, that they have really clear instructions from a timing perspective as to when to send people to medical care. And really that should be no more than 72 hours. I mean, after 72 hours of first aid, if the person is not better, they really should be transitioned to the care of a physician. Implementing long established best practices is, I think, across the board a recommendation. There are a lot of great resources, best practices going back to 1993 that we did not see being implemented. And so making sure that those resources are known and that they're being implemented before any kind of consideration of an increase in line speed, I think would be really important. And considering approaches to encourage establishments to share best practices, I think is also another really important thing. If you talk to someone in the auto manufacturing industry, they have decades long of history now collaborating with each other, collaborating on different research projects to tackle challenges in the industrial process. And I think that approach would be really helpful for both swine and poultry processing plants. So where do we go from here? This was a really big study. It was done in a very short time period. I would say, I think the whole thing from planning to end was 18 months. And we evaluated, we went to 17 different establishments for both swine and poultry, had nearly 100 students working on this, both collecting data and analyzing data. And when you think about the data that we collected, it was appropriate for this particular question, given the litigious nature of this question around evisceration line speed. And so the objective approach was really important, but it also was really time consuming. So we analyzed 1,693 different videos. It took about 2,000 person hours to do that. And, we had roughly a similar amount of EMG data, and that took 1,500 person hours to analyze the EMG data. And so this process, although really objective and effective at measuring hazard, is not really yet scalable. And that's something that I think is really important for researchers to work on in tandem with practitioners to make sure that we can make this technology usable in the field. And so if we think about the HAL and the normalized peak force, um, there's different approaches to using these. And if you know anything about the history of this tool, it was utilized really using observational, the Borg CR10 scale or the HAL scale, and an observer would really rate the hand activity level and normalized peak force using these 0 to 10 scales. If you're doing that, I think that's appropriate for hazard surveillance, meaning if you're trying to monitor and identify sort of the general hazard at various jobs at a plant, I think it's really effective to use that as a first approach, just to flag different jobs that likely need a more in-depth and accurate analysis. And I wouldn't just, if I'm using the observational approach, I would probably, say, okay, anything that's even relatively close to that TLV line, that line, dark line of the TLV score of 1, should be triggering a more in-depth analysis. But you can also use the TLV for hand activity for hazard measurement, like we did in this study here. You can also use it for mitigation. If you are interested in this case to evaluate a new knife sharpening program, you could use this approach to measure hazard before and after you intervene with, say, a new knife sharpening program. And so that in this sense, there are different methods that you can use for evaluating the TLV or using the TLV for hand activity for these different applications. And of course, we would ideally love to use tools like this for design so that we can proactively design jobs that are safe. And so I'm going to talk just a little bit in my remaining minutes about the different approaches to estimating the TLV for hand activity, the PFI TLV score. As I mentioned, the first one is for normalized peak force. We have 3 different approaches. There's the self-observer rated approach, which is easy to use, quick and easy, but does require a trained observer. We have the electromyography, surface EMG, which is what we used in this study. And then there's also a biomechanical approach, and I'm going to talk about each one. So the NPF, you can use the visual analog scale or the Borg CR10. There are studies that have looked at worker ratings or observer ratings. In our consortium study, we did ultimately use the observer ratings to be able to have sort of a more equivalent approach to comparing different jobs. Surface EMG, that was what we used in this study, and I think it's a really great approach. However, we have a little bit of work to do to make it more scalable and sustainable for a variety of practitioners to use in the field. The other thing that I just want to flag is that the processing methods can affect your APF values quite substantially. And so this is something that I do think we need to make it, we need to come up with a standard approach to processing the data. Here you can see that using a 20 hertz high pass cutoff would give us an APF value of 46.7% NBC, which would be like a 4.7 on the NPF scale. And if we change that to 140 hertz high pass cutoff, which sort of ignores a lot of the data, we would get a 35.3% NBC, which would be like a 3.5 NPF score. And so clearly, if you're going to use surface EMG, making sure that you're using more standardized approaches to processing the data is really important. Now, you can use a biomechanical approach. If you know the weight of the object, and the posture of the hand, you can incorporate things like the coefficient of friction to determine how much force is actually applied to support that object. This is nice because you can compare it to a referent population strength, like the 25th percentile female. And so it's really helpful when you're designing jobs and you want to design for a large population to utilize this approach. This is a lot harder to do and really nearly impossible to use when someone's using a tool. So it does have that limitation if I'm using a knife, for example, the knife might weigh a certain amount, but I'm exerting a much heavier hand force in using that knife, which makes the biomechanical approach unusable. So to summarize, there's pros and cons of each of these. And these are, for the self-observer rated, this again is really nice for surveillance. It's quick and easy to deploy. The con is that it's subjective and there's a lot of inter-rater variability. For EMG, it's objective, continuous, and best for tasks with tools with many postures, but it requires technical expertise and you can get variability with electrode placement differences. And for the biomechanical approach, you don't need any specialized equipment, which is useful. It's really useful for applying or designing a job relative to a population, but it's not very helpful when the task includes holding different tools or there's multiple hand postures in a task. Now for the how, I do just want to go over that. There are there's an observer rated approach using the how scale. But there's also been some research done on using things like computer vision to detect hand posture as well as different objects to try to quantify how scale, frequency, and duty cycle. There was a paper by Radwin and his group that really nicely utilized computer vision to estimate a HAL score. And so that's really promising, but can also be challenging in the field where there's a lot of different people working closely together or challenges with environmental conditions like lighting. A group from Germany put together a model where they used IMUs, they used kinematic data from these inertial sensors and potentiometers to create a repetition score to replace the HAL score. And so this is a nice way to use IMUs to essentially quantify the HAL. And they used EMG to quantify the normalized peak force, similar to what we did. The challenge here is that they identified a HAL score, but they didn't necessarily get a frequency and duty cycle, which is really kind of needed for designing jobs. And so if we look at, we have this similar pros and cons for the observer rated method of the HAL scale. Computer vision is nice, it's fast, automated, eliminates the need for that video analysis using MBTA. But it is sensitive to environment. We think to video angle. Right now, I think Dr. Radwin's still working on this, but there's no frequency or duty cycle measure, but that could be coming. And that could have some really nice applications in certain scenarios. IMUs provide us an objective continuous measurement. However, you do need this equipment. You need to know how to apply the equipment. You need to know how to process the data. And again, currently the model utilizing IMU still doesn't give us this frequency or duty cycle number, which is really useful in design. And so going back to these applications of the ACGIH TLV for hand activity, we can see that the observer approaches are really good for hazard surveillance. There's now currently some applications for wearable technologies like EMG and IMU and computer vision to give us measures of the HAL and NPF. And I hope that we see those become even more sort of available to implement for practitioners. The biomechanical approach is also a good approach for identifying the different forces required for a target population. And really that's what we're needing for applying this tool to design. In summary, we saw that swine workers are at high risk. They're in pain. They're not always reporting their pain. And I hope that we can move this industry from being really reactive, which is what I would say is happening right now, where there's complaints. And because of those complaints that triggered, for example, the study, to a more proactive and an even advanced approach. And I think that building on these technologies and developing them further can help make them more scalable so that we can encourage their use in programs that move from being reactive to proactive and advanced. And some of the questions that we hope to be working on in this space include scalability. What is the right mixture of technology for which environments? How can we automate things like synchronization and processing of continuous data? And how can we train people on how to apply and implement these technologies into practice? And there's a lot of questions around sampling, how many workers, how many task cycles, how many minutes of sampling, that fortunately this data set will be continued to be used to answer some of those questions. In closing, I want to thank the USDA for their support. I also want to thank the establishments that let us come and take measurements and spend some time at their facilities. I also want to thank the UFCW for their cooperation and support of the study. The sites that they were at just ran a lot smoother. Our program is also supported by NIOSH, the NIOSH training grant. And we really want to give a shout out to our NIOSH colleagues and encourage everyone to continue putting pressure on their representatives to keep NIOSH. They're so important. We'd like to, I really want to give a shout out to all of our students and faculty and staff who collectively put thousands of hours on this project. And so with that, if there's any questions, I think there's a few minutes left for those.
Thanks, Carissa. Yeah, we only have a few minutes remaining. And so I will say that if you do have a question that's burning, you feel free to reach out to Dr. Harris via email. For now, we'll take I think maybe 2 or 3 minutes left to see if we can, Carissa, if you could provide a brief answer to some of these. First one we'll give you is the differences in the facilities where you saw a sort of increased versus decreased risk of MSDs. Was that related to the number of workers on the line? So more people present doing the job for a decreased risk, and then fewer people for increased risk?
Yeah, so it was interesting. It wasn't as clean as we thought. We thought that when establishments would go up in evisceration line speed, that they would increase the number of staff in the same jobs, and that actually wasn't always the case. So they were pretty targeted, and their approach to increasing staffing differed across the establishments. So I don't think it's as easy as saying you just need to staff up in all the jobs. I mean, that may or may not be necessary to get all of the scores below a PFI TLV of 1. But I think it's more of like which jobs and how much, and are there any other concurrent things that you can do? So I think it's a little bit more strategic and specific to the individual establishment's process. Because there are differences in how they perform some of the same jobs.
Thank you. Mike asks if using the EMG cuff, do you think we could detect differences in the force from meat cutting knives that were sharpened at the 2 different angles, the 17-degree and 21-degree angles? Do you think EMG cuffs could? He said that workers complained when the robots were brought on to change the sharpening angle to 21 degrees. And do you think that difference could be revealed or quantified using EMG?
Yeah, I think it's possible. Again, EMG is not quite as sensitive as humans are in detecting differences in hand exertion force, but we would love to go and do some more studies on evaluating different aspects of knife sharpening programs. So that's one variable, but there's also a lot of different variables that we can look at in knife sharpening programs. And I do think that EMG would be a great way to evaluate that.
Excellent. Next question. How did we address the potential of workers to not providing accurate information based on the same fear of reporting their discomfort to anyone?
You mean accurate information as far as whether or not they were in pain?
Yeah, like just information. How can we trust the information we got from surveyed workers? How do we know that they were candid with their responses? Maybe they had some fears around their responses. How did we address that?
Yeah, I mean they may have, but you know, I know from the surveys that I did, there were occasionally a worker that you could tell they were just trying to get through the survey, and maybe didn't, maybe moderated their responses. I do think we had a lot of Spanish speaking students helping with the surveys, and also staff and even faculty that spoke Spanish doing these surveys. I think that we did a pretty good job, especially as the study went on, of really spending time, like a day before we even collected data, telling people who we were. We had a table at lunch and just to talk to people and let them know who we were and that their data was completely confidential. So I actually think we got pretty good feedback. We had physicians there who were talking to them, so there was a lot of relationship building, I think, with the
Absolutely.
workers.
Absolutely. Okay, well, thank you very much. Excellent presentation. I think we'll wrap it up here. Thanks everyone for joining us. You can learn more and register for our upcoming events at coeh.berkeley.edu. You can also subscribe to the YouTube channel where you can find recordings of previous webinars and other events. Don't forget that if you did sign up today with your registration email, look for a link for an evaluation form, and that's going to qualify you for a CE Continuing Education Contact Hour. If you have any questions for us here at COEH Northern California, go ahead and drop us a line at coehce@berkeley.edu. That's coehce@berkeley.edu. A big thank you again to Dr. Harris. That was my pleasure to host this one, especially, and we'll see you all next time. Thanks, everybody.
Thanks.